everyone. Welcome to yet another episode of Spilling Tea. I am your host, Tiffany Daniels, and this is going to be a part of a set of videos that is going to confront the many myths out there in regards, excuse me, to what causes autism. Today, we are going to start with one of the biggest and most prevalent ones. Yes, folks, I am going head to head today with the anti-vax movement and the myth that the MMR causes autism. Now, we are going to read through this article. We're going to go through a little bit of background today. And this article is called How the Modern Anti-Vaccination Movement Emerged. I am going to make sure to include the link to this article in the description. Okay, so let's read through this. Today's anti-vax movement is similar to those early activists in terms of false messages they send about the supposed dangers of vaccines. One marked difference is the platform that current anti-vaccination advocates use to promote messaging. The internet and the rise of social media, in particular, have allowed activists to speak on a large global stage and develop sophisticated methods to influence and persuade audiences. The dawn of the internet age in the 1990s coincided with the publication of a now infamous research paper that falsely connected the measles, mumps, and rubella MMR vaccine to autism. That paper, by disgraced former doctor Andrew Wakefield, was highly flawed and would eventually be debunked and retracted. Despite these measures, Wakefield's paper continues to circulate online and has excuse me, and has attracted legions of followers. Social media plays an increasingly large role in the way people access information. A 2018 study published by the Pew Research Center found that nearly 70% of Americans got news from social media. Of those, 43% had reported Facebook as the top source of daily news. Excuse me, Missouri allergies. These findings pose a challenge to vaccine programs, as Facebook and other social media sites do not discriminate between legitimate news organizations and those that promote misinformation. Unlike traditional media outlets, social media pages do not need to abide by editorial codes of conduct, follow the tenets of accountability and transparency, or even stick to the facts. In the context of vaccinations, this has resulted in proliferation of social media pages that attempt to persuade the public using any means, even if it involves veering far from the truth. Points of consideration. In 1998, Andrew Wakefield and 12 co-authors published a study entitled Ileal Lymphonodular Hyperplasia, Nonspecific Colitis, and Pervasive Developmental Disorders in Children in The Lancet, a renowned medical journal. This paper speculated environmental triggers that led to chronic enterocolitis and regressive developmental disorders. Only 12 children were included in the study. The study used a non-controlled retrospective, a research design that concluded an illogical link between the MMR vaccine and autism. This paper was later retracted by The Lancet, along with the statement reporting no causal link between the MMR and autism, citing insufficient data. Furthermore, it was later discovered that Andrew Wakefield failed to disclose his financial interests in his paper. He had been funded by lawyers who had been engaged by parents in a lawsuit. Isn't that interesting? Follow the money. It was also discovered that he misreported sampling techniques and falsified facts. Numerous large and credible studies have since refuted the link between autism and MMR. Video clip 6.1 offers a historical perspective by Dr. Health McDougall on vaccine hesitancy and how it has emerged as a current topic today. Let's watch.
Vaccine hesitancy is, of course, a 21st and late 20th century phenomenon, but I think that it actually has deeper roots. If you look back at the development of the polio vaccine and the measles vaccine in the 50s and 60s, what you see, because there was immediate uptake and then a decline in the number of people who were vaccinated, is commentary from the medical profession and the public health officials regarding the fact that as the disease stopped being visible, parents became complacent, or in some instances, according to some people, apathetic. In point of fact, I don't think that was what was going on. As the baby boom became young adults and set up their own families, most of the women began pursuing higher education and went into the workforce. So it was very difficult for them to gain access to their family physician or to the local public health well baby clinic. And so it was a matter of access, a systemic issue, rather than an attitudinal issue. Their children, as they began having their families, though, in the 1980s and the 1990s and beyond, were facing a somewhat different situation. They tended to have moved away from home and not have access to their mothers and grandmothers for support. And that led to a change in attitudes toward parenting. Parenting became something that you looked into advice books for. And depending on the advice book, you were certainly told that immunization was a good thing, but you weren't necessarily told when and where and how it should happen. And that led to two questions. The advent of the internet, of course, led to the creation of mothers groups and mommy blogs, and in effect closed communities where the whole process of immunization was being discussed. And depending on the attitudes within your blog, you were either in favor or questioning. And some of those questions, of course, originated in response to the article by Andrew Wakefield that suggested that the MMR vaccine contributed to autism. Although that article was debunked and continues to be debunked, it became, I think, almost folklore. And the problem with that is that that's very difficult for public health and healthcare professionals in general to combat, because it's based more on emotion than necessarily on reason. Although it's very interesting that the people who oppose immunization are willing to cherry pick information from scientific literature and use it to convince people not to immunize their children. As a result of the catalytic effect of this on parents from the turn of the 21st century to the present, immunization rates fluctuate in various places. And of course, the current measles outbreak in the United States has filtered into Canada, and we're well aware that disease is only a plane ride away. So, how do public health professionals go about responding to vaccine hesitancy? Historically, they tried to use scientific information. That really didn't fly because their opposition was in fact using emotive stories. Perhaps the most effective approach is to enable parents to ask when they bring the child for the immunization procedure any of the questions that are really at the heart of their hesitancy.
So you definitely got a little bit of information from there. So basically, folks, what this is telling you, this whole anti vax movement got kicked off by Andrew Wakefield. And it comes from this deep seated fear, this idea that this thing that we call autism is just this some horrible thing that swoops in, steals your child, and replaces them with something else. It's the whole changeling theory. And because of this fear of what if my child is autistic, with the propaganda out there that autism is worse than death by some groups whose name I won't mention, Autism Speaks. Excuse me. Parents then are in a sort of panic and they begin looking for answers, anything to prevent this thing that society has beat down into them is worse than death. And they find these social media sites that have been around since the late 90s, especially with their boon in the early 2000s, and they jump on board. Unfortunately, these folks are also likely, much more likely than the average person, to fall victim to the many snake oil salesmen out there in the world that are willing to sell them a cure for an outrageous price. So, folks, the actual facts are Andrew Wakefield, his paper was discredited. His doctor's license, his ability to be able to practice medicine, has since been revoked. But due to his paper, the re-emergence of measles, mumps, whooping cough, even in small doses, polio itself have all made a comeback. And this anti vax movement does stand to possibly create a horrible public health crisis. I have family that has worked in the medical fields. I've been around it my entire life. And when you have kids dying from diseases that were basically almost completely eradicated, like from when I was a kid, that is extremely disturbing, folks. It's extremely disturbing and it's dangerous. It is also dangerous to think that you would much rather have your child possibly contracting one of these diseases that does have a possibility of killing them rather than have them to be autistic. It sets a very dangerous precedent. And that is why the autistic community, right along with the health community, fight so hard to dissuade people from this notion that the MMR vaccine causes autism. There has been multiple papers and tests and research that has gone into debunking this myth, yet it continues to persist. And that myth is now influencing many people's fear about the new coronavirus vaccines that are out there as well. So you can see how dangerous this actually is. But what all the studies have shown over the years is that autism, ADHD, all the many neurodiverse disabilities that these anti vaxxers would say are being caused by the heavy metals in the MMR vaccine are, by and large, actually genetic. As I have said on many streams now, a good majority of the time, if you take a look at people's family trees, you're going to see one of two things. Somewhere in the family, you're going to find an individual with a neurodiverse disability, be it ADHD, dyslexia, autism, what have you. Or you're going to find someone, usually a parent, with what we call shadow syndrome, where they do not have enough traits in which to warrant a diagnosis of one of these disabilities, but they do have very prominent traits that feature very heavily in the diagnostic criteria when one gets diagnosed with one of these. So, folks, that is us covering the MMR myth when it comes to what causes autism. We're going to be going over a few others as we go throughout this series. Now, folks, as always, we don't get many views on this channel, so please don't forget to hit the like button, hit subscribe, don't forget to hit the comments. Also, I do think this is a very important topic, especially with the pandemic going on and the growing concern in regards to the current vaccines. So please share this on your social media platforms. I do appreciate your time this afternoon, and I hope you all have a good one. Bye-bye.